Hey everybody, this is Dr. Leonard with Central Ohio Spine and Joint here in Columbus, Ohio. I wanted to touch a little bit more on trigger point dry needling, one of the probably most useful services that we offer here in the office. So I'm going to have zoom in here. We're going to look at, so this is a trigger point map. They've essentially mapped out when you have active trigger points where you're going to feel the sensation of pain. Probably the two most common areas that we see with patients are up in these trap muscles or up near your shoulders and neck. If you've ever had someone kind of rub your shoulders and they reach like that little knot area, that's actually a trigger point. And what this map shows is exactly where you're going to feel the sensation of pain once you've hit that trigger point. So if you come on over here, so what we do is we use these trigger point dry needling. So this little needle is a little thin filament needle here. It's flexible. It's very, very small. So what we do, and I'm going to show you on my arm here, I'm not going to show you on the trap, is we'll palpate along and try to find those trigger points or those kind of tight bands within the muscle. So once we found one, which I've got one right here, we're going to do a little tap with the needle, and we're going to do just a little bit of pressure into the area, slide that needle into the tissue. So one of two things is going to happen. Number one, you're going to either see a little twitch within the muscle, which is called the local twitch response. That means we've hit directly on the trigger point and the body creates a little neurological twitch. That's a really good indication that we've hit right bullseye on that trigger point itself. The second thing that's going to happen is you'll see actually on this needle is you'll see that the skin start to what's called tent up, or essentially it's going to start to lift up a little bit. The muscles themselves have a really detailed fascia network. Fascia is kind of the tissue that holds the muscles together. And when you have tension in the fascia, what happens when that needle goes in, it's almost like a spider web. That spider web grabs onto the needle and kind of holds onto it, and you'll see the skin start to tent. As it starts to release, we usually leave these in for a couple minutes. You'll see the skin start to relax a little bit, and that needle, you'll be able to slide it right out with no issues. So again, trigger point dry needling has been a very, very great addition to our treatment approach here in the office. It's typically used in combination with other services that we provide, like manipulation, exercise, stretching, even massage therapy. It's a really good tool at minimizing pain very quickly. We talked about the trigger point mapping. What we'll do is I'll actually include a picture of the map on here. If any of those pictures look like the symptoms that you're experiencing, feel free to reach out. We'd love the opportunity to take a look at it, see if we can help with some trigger point dry needling. Hope you guys enjoyed the video.